somewhere around 75 to 90 degrees of range of motion. You can see I'm right around 88, 87, something like that, so that's a healthy wrist. But some people get stuck here and they don't have the ability to get the wrist to manipulate and move inside of the joint properly. There's a couple things you can do to work with a wrist dysfunction. The most simple thing is you just turn your hands backwards. And I'm just going to do one at a time. You can do both, but one at a time is really easy. And now you're bearing weight. So the more forward you are, the less sensation you're going to feel. And the more back you are, the more you're going to get a stretch in these extensors, or excuse me, in the flexors, and the more you're going to be able to open up the joint. But you have to do that to your pain tolerance, your capability. Once you're here, one of the tricks to getting all of this to open up is actually within the fingers. The fingers are hardwired and connected to these flexors. They're actually functional opposites in terms of finger extension and gripping of the flexors. So when your hand is like so, you'll take your pinky, lift it up, index finger, middle finger, oh, I guess that's the ring finger, index finger, thumb. And just to show you that from the side, I'm here, pinky finger, ring finger, middle finger, index, and thumb. That's going to get a different stretch through different parts of your wrist flexors here. Now you don't want to put too much pressure on the wrist, so if it's too much, back off. But if you can do it, it's just to open up the wrist. Then you want to make sure that you get the elbow involved and other aspects of the wrist involved. So you want to play with elbow rotations. So turning the palms up, turning down, up, down, just to get some motion in there. And then you can play with what's called radial and ulnar deviation. So you just go side to side with the wrists, just like so, just to loosen them up and warm up any kind of range of motion that might be limited in there. Another fun thing to do is to take a yoga block, and you're going to place your hands down on the floor like so, and then your elbows down on the floor. Now when you place your elbows on the floor and the wrists and hands on the floor, you can see that a part of the thumb side of the wrist pops up. When I do it from the side, from here, when I go down, the thumb side of the wrist pops up just like so. So you want to work to push that thumb side of the wrist down. It's a lot of work in this forearm, but it starts to muscularize and strengthen the forearm muscles and help to align the radius and the ulna with the hand bones. You can also use a hand to press it down and play with that. Okay, so that's another way just to start to work into the wrists. Now we're going to play with something a little bit more complicated. Really simple. Instead of just thinking of a wrist issue as a wrist issue, we want to think of a wrist issue as possibly an elbow issue, possibly a shoulder issue, possibly a neck issue, maybe a nerve issue. There's so many different aspects to what will control range of motion and what will limit range of motion. So what you're going to do here is your affected arm, you're going to take it out to the side like so. Now notice that my shoulder's not up at my ear. I'm taking the top of the shoulder down, and then my hand is flexed upwards. The key to this, and you should be able to feel kind of it's a nerve glide, a stretch kind of through here. But the key to this is that on the hand, you have different joints of the knuckle. This is called the distal interphalangeal joint, or DIP, and this is the proximal interphalangeal joint. When you go up into this right here, I want you to pull the proximal interphalangeal joint, the PIP, and straighten it and pull it towards your face. What do I mean by that? Here I am. Now, if you can zoom in onto my hand. This is the PIP of my index finger. You're going to pull that PIP closer to your face. And then you're going to do that with the thumb, the middle finger, the ring finger, and the pinky finger. You will feel like the skin of the hand is starting to spread, that the hand is opening more and more, and that the stretch is actually getting more intense through here. So we're working on opening up the nerve and opening up the pathway through the whole fingers to allow for the wrist to be able to move better. The last thing, and one of the most important things, especially if it is simply just a jammed wrist and the wrist isn't having the motion, if you come with me for a second, You gotta take a strap, a yoga strap. It can't be a bungee. It's not as effective as a bungee. And put it against something like this so it's locked in and isn't gonna move. That goes right at the joint of your forearm and your wrist. Your hand comes like so, and then you just gotta lean forward. So you're leaning forward while this band is tractioning your joint backwards and creating space in the joint. You can stay like so. You can do repetitions like I'm showing here. Whatever it is to do, you're here and you're looking to get that wrist bones, wrist joint to open. Okay, try that. I hope it helps you. I hope it opens up the wrist. Good luck.